Hello, hello, hello. Today I have with me, again, we meet. See if I'm saying it right, Dr. Iryna.
Yes, right.
Okay. She is from the Ukraine and she is working in Dubai. And it was imperative that we talk again today. How in the world are you doing? What about your parents and your daughter?
Oh, thank you very much for having me here. Hello to everyone who listen us. And yes, it's quite complicated to speak about my relatives now because so far my parents living next to Kiev. It's quite dangerous, because there is no safe place in Ukraine anymore. So they're still in touch with me, and as much as I'm informed, everything is okay. We in touch every 1 hour, frankly speaking.
Oh, that is so good. And I'm so sorry they're going through this. Now, do they live in the same house you grew up in? Do they live in your hometown, your parents?
Yes, actually, my parents living in my hometown. It's only 75 kilometers from Kiev, and there is no safe place, as I mentioned before, because that city already had a bad experience with bomb explosion, and you know I can't tell you more because it's that bomb explosion was next to my parents' house actually.
Oh,
So
and
and every morning I start with I calling them, and as lots of people who live in not in Ukraine, we start our morning and we finish our day with simple message: Are you alive? Everything okay? I would never could imagine that I would send that kind of message, and that's true.
I can't imagine. I can't even imagine. I'm so sorry. And I was going to ask, with your history, I know here we have such freedom. You have never experienced this. Can't imagine having to ask if you're alive today. And didn't you tell me as well your daughter is there?
Yes, actually, I'm from Kiev, and I've been joined this hospital in Dubai 6 months ago. So, and we live in Kiev, and basically we live in downtown, so it's central part of Kiev, and that's quite hard to be in downtown because it's anytime they bomb, anytime you have a chance to be attacked. So all those houses they could easily be affected. So it's like it's like lottery. It's become very dangerous to be here. So it was also dangerous for her and challenging time, and she had to be in shelter with other neighbors. And actually, her boyfriend had support her. And actually, yes, it's scary. It's impossible to understand how they felt in these shelters.
Mm. And for today, you know that she, her boyfriend, your parents are alive.
Yes, just before we start our conference, I spoken with my parents. I spoken with my child. Everything is good, and actually, I'm happy today. I can smile a little bit because my daughter not in Ukraine anymore. I'm proud of her because she left Ukraine. It was again challenging because some people in Ukraine they decide to stay just because they're afraid to go because it's dangerous to stay, but at the same time it's quite dangerous. It's huge danger to leave
Oh,
because you never know what will happen on your road, and
right,
it doesn't
right.
matter to go by car or you will go by train. Still dangerous and dangerous.
Yes, yes, yes. Are your parents healthy? Either of them diabetic?
Oh, fortunately, they're not my patients. And of course, I support them as much as I can. Yes, they have certain disease because they are not young anymore, but everything is fine so far. I try to control their health even from this country. And also I try to be supportive, because of mental health. everyone now affected in Kiev.
Oh, absolutely. Are you an only child?
Yes, I'm the only child, but you know, it's not interesting today speaking about me. Actually, I have the only child, my daughter as well. So just you can imagine if you're a mother. So my heart and my soul, it's not here anymore, and actually, it's been always with my daughter.
I
So
totally understand, and I don't understand, but I totally know you don't want to talk about you. But I want you to know, forefront, my heart, I'm praying for you. My thoughts are with you. And as we've spoken offline here, I'm willing to help in the mental health arena in any way I can. So, what I want you to do is help us understand, is there any way we can help? Tell us things that we can do, things we can pray about. Just in what can we do? How can I be your sister today?
I'm really appreciate your attention today, and I'm so proud to be with you here on this podcast because I want to translate this pain, these feelings to other people. Because look, we never know that it will happen with Ukraine, and now some people they could think that look, it's not our problem. It's so far, but now when it's quite dangerous because they often and often start to speak about the nuclear power, and it's getting complicated for all world. So it's I just try to not to be active by saying that it's not only Ukrainian problem anymore, and even Europe clearly understood that we have to work together toward to stop this war. I want to speak about politics because I'm a doctor, and first of all, for me, it's important. It's everyone around me be healthy. Everyone, everyone deserve it. Good health. It's everything. If you're unhealthy, it doesn't matter what you are doing, who you are. So, by staying here, a part of my parents and my family and my friends, I try to be supportive as much as I can. I recently joined to the volunteer doctors organization. It's like, it's working like a platform for all people in Ukraine who seeking doctor, who stuck in their houses, who can't reach hospitals because hospitals, some polyclinic they closed and hospitals don't work. And some people they stuck in small towns and they can't reach as well healthcare provider. So we organized a platform was organized. Now it's nearly 40,000 people together, all doctors and all patients together, and you can get consultation very easily. And I'm working with this like a volunteer, and frankly speaking, I feel great relief with this, because I can't sit here and do nothing, because if you want to help, your mind will get crazy without try to help. And also I working toward it's very complicated because I'm from Ukraine, I'm a doctor, and I very well know how doctors in Ukraine working now, because there are lots of difficulty, including financial problem. So I decided to try to support our doctors with small financial support. And we already, I asked some of my friends, they support this idea. And we try to collect even small amount of money for my hospitals when I work in previous. Because it's complicated to explain everything. Since that war started, some of doctors and medical staff, like nurses and other medical staff, they enter hospital and they still working there without going home because they can't reach their houses. So you just can imagine how they can work, without just easy things for themselves.
Right.
So that's why I decided to support. Of course, I can't cover all hospital, but at least we cover few departments, and I'm happy.
How do
And
we,
I'm really,
how would we help financially? How would we get our money? What can we do?
you know, it's hard because, look, first of all, I'm a doctor. Yes, I could never be like be in touch with financial. Yes, I don't know this stuff. And in my view, that was very simple because I wanted this help go directly to the doctor. Sometimes I don't want to speak about my hospital, but sometimes some people, when you just give money to that fund, could money will never go to the doctor directly. So I choose this department and choose doctors that I trust, and I directly, support them, this department. But I have to tell you, it's not million, money. It's like small money, small amount. At least they can buy food. They can buy some needs, some small needs. By the way, it's needless to say that they have some food at work, but I'm in touch with my previous hospital with some of the doctors by special group. And when I start to read this, that, oh, I'm sorry, I have to work today, I have no food, and other doctors as well. And the next doctor, he just advised this doctor, can you check in my room, because I might have some tea and chocolate. Doctors sometimes could have it. So it was disaster because they could share the tea, the chocolates, what they have, just to have small amount of food. And from other part, I would really, really happy to know that now, since war started, lots of volunteer organization like restaurants, they try to arrange some food delivery to our doctors as well. So together, I think it's a good chance to support them.
Yes. So we are so organic in this conversation that I don't have a clue what I'm doing, but I'm going to, after we're offline, I'm going to find out a way to send my donation to you. And you can make sure, is that okay? Or you can tell me where to send it so that we know, here's what I want to do. Whatever you say they need, food, I would love to think I could be a part of supplying those doctors with a little bit of food today. I would also like my little contribution. I would not mind if you give it to your parents. I wouldn't mind if you have a friend. But after we're off here, I will find out from you so that I can send mine. And I'm saying it online so that if anybody hears this, they will too say, what can I do? And then if that's cumbersome for you, then we will figure out a way. But we want to get it in the hands of the doctors. We want to get it in the hands of people who need to eat. And we'll just do this. I mean, who knew this day was coming? And we don't have to be pros at it. We just have to have love for brothers and sisters and each other. Because here's the truth. What I heard you say is you couldn't imagine this day. You couldn't imagine this day coming. And also what it's done to your spirit and your heart. I can't imagine the people there. And so besides the finances to put food in their mouth, what can I do? I want to be one that offers counseling. I realize I only speak English. I know you've worked on getting me, you have me one patient ready to see, but
Yes,
I want us to get I want us to figure out how more than me, if I can help somebody and I can give of my time, I want to figure out how to do that and then ask others here to come and do the same thing. I cannot imagine the emotional turmoil. And if all we do is sit online and hold their hands. And so if clinicians that are in my field want to come by and help, you and I will figure that out, right? We're going to figure out if I can get on, then we can get somebody else on. And I will ask people here to announce it as well and try to get volunteers to come and love on your people.
Thank you. Thank you. That's so touchful. And actually, I would like to, like launch some. I was thinking it is my dream to launch company help doctors. Because look, so we thinking about soldiers because it's first. We're thinking about all people who need everything, but we always forgetting about doctors. They're working hard. They have little salary, but they still working hard. And I know them very well because I've been working with these hospitals expert and specialist for more than 15 years. So by sending money, I can trust they will spend it, very well. And I don't know, maybe it's not good. I don't know if it's legal or it's illegal because they have to launch some fund. I don't know how to do it. Look, I just do simple directly sending, just try to be sure that they have something.
Yes.
Because it's so tough to get this message. I can just even I will try to find for you because it's my phone. That message that my doctor said, yes, like, my dear, I'll try to find out. Sorry. Yeah, it should be somewhere. I don't know if I found. So just it's saying that look, all money you say I'm gonna spend for some food because my surgeons already, in operation theater for 5 days. So how
Well,
how 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 do they work? And actually I'm really appreciate all my friends who supporting me. I have very friends, they become very close to me. This female, my friends here in Dubai, she's hairdresser, her name, and is Oksana. She's supporting me with this idea, and we start together to collect even small money, $10, okay, $15, okay, because we can collect and we can send and everything is good. I don't know if it's legally to do it, but it's like directly help. And I don't know, it was just my crazy idea. I tried to do it. And actually, it only 2 departments for 3 days was supported, yes. And my hospital, huge, it has around 30 departments, but at least main departments and doctors that I can trust was, with this. And actually, some of my friends, they from Ukraine, they live in here. Some of my patients, they start to ask me how they can connect with me for supporting money. And my idea was, you don't have to support my hospital, my doctors, yes? It's any doctors, if you know from your country, just send small amount of money to support, that's all. Like, because I think any hospital now under the big pressure and working with big tension, and it's hard. Believe me, it's hard with this amount of salary, high level of responsibility in the same time. It's hard.
I
So
totally
yes,
want to get that word out. Now, as far as patients with diabetes that are there, what is being an endocrinologist, you may have some information about at least that one hospital. How difficult is it for the type 1s to get insulin right now? Has that been an issue, or what's going on with that?
yes, by doing this online volunteer consultation, I found out that some of patients, they just lack of insulin, and some patients, they have just small amount for a few days, yes. And we consult how to try how to save insulin, because there are some tricks you can do with reducing food, reducing carbohydrates. For instance, that patients who stock in small cities, they can get it. But it was only for few first days, yes. But after volunteer organization, over the all Ukraine, they tried to connect with pharmaceutical company, and also I connected with pharmaceutical company, so they could reconnect patients with directly supplying of insulin. Now we have special, phone numbers, and patient can connect with them. But unfortunately, still with these small cities that they stuck inside the cities, it's dangerous to go outside. Sometimes we have this problem, and it's look, some city it's not possible to get this insulin. So I don't know how people will survive, because it's catastrophe for people who are under hormone replacement therapy, and also other people who under like thyroid hormonal treatment. We try to consult them in clever way, at least if they stop without hormones, how they can save this amount of hormones. Also, it's not correct dosage, but at least they have small amount and every day. So it's, it's, I never thought that I could be advised, this amount of
I know.
hormones. And in this situation, it's quite challenging for doctors, and it's a disaster for patients.
Oh my. But we know if we can get a little money together, there's food to be provided. They can get their hands on food if they had the money. But we don't know, if I'm hearing you correctly, we don't know if we send money for insulin, if they can get it.
Yes, but already we have insulin, because people from Poland, from all closest countries, they start to be in connect, and they know how to enter the borders. Yes, if, for instance, if we have train to the cities next to the border, so on the way back, or they somehow organize some cars and deliver it to the small cities. So now they're working on it, and their organizations, they try to cover this problem. Yes.
Okay.
Yes.
So my heart today is about those type 1 diabetes patients who can't live without that insulin. So I don't know that I can do anything about that, but I can pray, and I'm going to continue to do that. When it comes to counseling, I believe that everybody there, everybody who has family there, everybody needs the support of somebody in my profession. And while it can maybe only be holding someone's hand virtually, I want to have the opportunity, and I'm going to work with you, and we're going to try to figure out a way to make that happen. I just want to say that out loud again. We're going to try to make a platform, a way for me to speak with patients from my expertise, but it's going to be human heart to human heart. Now may not be the time that you want to work on reversing your anxiety. You just need somebody to hug you and have someone virtually be there for you. So I'm going to be asking people that want to do that. Again, I don't have a clue how, and you don't. But the other thing is, we want to financially help these doctors who are helping people. They're staying away from their families. They're staying in the hospitals. They can't get home. They don't have food. They're sharing a little bit of tea, a little bit of chocolates, anything they can find that they can share just to help the patients in need. And that's where our concentration is going to be, on helping those doctors. We can't do it all, but we can do a little bit. And I want you to know that my goal is to help you today. My goal is to be, when I say sister, I know biologically you have none, but I believe in these kind of times we can lock arms and help others. And if we help others, that's supporting you. And that's my goal, is to help you. And so I help you today by supporting others. Is there anything else you want to say before we get off this call?
Yes, I really appreciate you inviting me, and it was very, very warm conversation. And actually, I don't know, I didn't have proper time to be ready. I just came from my work here, and it's quite sad topic. And let us hope that everything will be safe and okay with our relatives, and I still pray for them and avoid. And I hope, I hope very, 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 I hope, hopefully it will stop, and we all pray and we all hope. We don't want this war, and nobody want to die. And even from other parts, they have lots of dead people at the moment. So I just pray. I want a peace in the world, and I'm here because I want to tell to anyone because we have to be supportive to each other. And to tell you the truth, Ukraine survived only because people so supportive to each other. They support with small food, small support. They have mentally support. They can even give each other small amount of, I don't know, food, whatever they can share. For instance, before we start speaking, I was in group with neighbors in my house in Kiev, and it was like warm conversation. One family, they left Kiev today, and they told, look, we have these things and you can use it because we don't need it anymore, but at least it will helpful for you. So every people try to help each other. So,
Oh,
and we will survive only if we will support each other. That's the mind stuff.
oh, that is
So,
so
yes.
good. So good, so good, so good.
So thank you very much, and really, I'm happy to be here. I'm happy to speak with you, and even I would like to say that you are a great expert in your specialization, because I've already feel kind of relief by speaking with you. Thank you very much.
Oh, well, I in myself have never spoken with someone. This is a first in a lot of years I've been on this earth. I've never spoken to anyone on a day like today when you are sitting where you're sitting. And I might add, you have such class and clarity and kindness and all those things that I can only imagine was helped along with good parents. And I know you have to be away from them today. So my heart says to you, I'm trying to be professional and I'm trying to be human as well. And so I have to say to you today, I love you. I love you already.
Thank you,
We
my dear.
we have watched a world that I didn't know about Ukraine. They're strong people. They're tough old birds. They'll stand up for themselves. And I am undergirding them and trying to hold their arms up from here in prayer. So let's keep communicating. And people, please, if you want to give, if you want to help doctors be fed while they help patients, or if you're a mental health counselor, some clinician in that field, or just somebody that wants to hold somebody's hand virtually. As we learn this, you text me, you get in touch with us, and we will make sure that we help in every way we can. Thank you so much, young doctor. You stay strong as best you can. You stay strong.
Thank you very much. Thank you. Hope we will never experience this again. Hope everything will be
Yes,
fine
yes,
with
yes.
Ukraine. Just pray for Ukraine.
Yes, ma'am. Yes, ma'am. Bye now.
Bye.